Announced a major move to curb healthcare fraud and improve patient access by rolling out a nationwide biometric registration system under the Social Health Authority. The new system replaces the SMS-based with the fingerprints identification scans and is expected to boost transparency and eliminate fake claims in the health sector. Peter Onsare has the details.
Kenya's healthcare system is going digital, with fingerprints at the center of it. In a move to end fraud, President William Ruto says all patients accessing Social Health Authority services in public hospitals will now be identified through biometrics.
Leo tarehe 4, Wizara ya Afya inaanzisha rasmi kwa level 4, level 5, level 6 biometric identification of citizens who are going to seek for treatment.
The registration will start at level 4, 5 and 6 hospitals, that is sub-county, county referral and national facilities, before moving to dispensaries and health centers. At the same time, the president warned county hospitals against charging patients for primary outpatient services.
Na hakuna mtu tena atatuibia pesa kwa sababu ile NHIF ilikuwa na matatizo makubwa sana ya wizi.
Kenyans needing emergency care will also benefit from a newly created emergency and critical care fund with 8 billion Kenyan shillings set aside. President Ruto says the old National Health Insurance Fund failed because of corruption. Hospitals had more accountants than doctors, filing fraudulent claims. Since its launch in October 2024, SHA has paid out Kenyan shillings 52 billion, more than double what NHIF manage yearly.
When you started working, Your Excellency, because we are now at 25 million Kenyans who are covered by SHA, the critics, instead of talking about it, they have kept quiet. They were making noise when it was not working. When it works, instead of making noise or celebrating now that it's working, they kept quiet. And that is very common, Your Excellency.
In Tharaka Nithi County alone, over 200,000 residents, nearly half the population, have already registered. The president also confirmed funding for roads, water and the long-delayed 7 billion Kenyan shillings Nithi Bridge, saying construction will begin before the next election. And with 170,000 affordable housing units under construction, nationwide, Ruto says the plan is to avoid an urban future defined by slums.
50% of our population will be living in towns, cities, and townships by 2050. And it is up to us to determine whether they will be living in organized cities and townships or they will be living in slums.
From health and housing to roads and clean water, the government says the reforms are aimed at dignity and equality for every Kenyan. But as digital health takes shape, the challenge remains, turning policy into impact. Peter Onsare for TV47, Nairobi.